So with us today is Dr. Perfilio Edwards. She's the class of 1998, so she graduated with Mr. Williams. That's why he was excited to see her today. She is in general OBGYN at
Catholic Health Initiative. I'm an OBGYN or obstetrician gynecologist. I have had a few different sort of type of roles. I have a clinical practice where I just see patients, do surgery, deliver babies, kind of the normal OBGYN life. And then I have an academic practice or academic portion of my career where I teach medical students and residents to also be OBGYNs. And I also had a third part of my career that I finished, but I was also in the military and did military medicine. So I can answer questions about all of that, any of those things. I live in Omaha, Nebraska. I got here by accident. I never thought I'd stay. This wasn't supposed to be home, but we really liked it out here. And this is where the military landed us. And so we stayed. Before this, I was at Wright-Patterson right there in Dayton, which you guys are probably familiar with. And so I kind of have lived in Dayton 3 different times in my life, and I keep going back. So we'll see if someday I get back to Ohio again. But for now, I'm an Omahan. That's what they call us. And I'll always be a Dayton Flyer because that's where I went for college. But now also I have to be a Creighton Blue Jay. So it's good now. Creighton and Dayton don't play each other in basketball, so it's not as stressful as it used to be. I graduated in 1998. I did go straight into college at University of Dayton and graduated in 2002. And then I went straight into medical school at Loyola in Chicago. And I did that pretty much straight through. I think now it's a lot more common for people to take gap years and to do other experiences, either research or medical scribing or, being a medical assistant or nurse medical assistant or whatever. I think those experiences are awesome. I think people that come into medical school with another experience, have a lot richer sort of sense of purpose and more maturity a lot of times than some of us who went straight through. But when I did it, going straight through like that was really common. And I think it's not as common now, like I said. Then when I graduated, I did medical school. Even though I was at Loyola in Chicago, I was in the military at that time. And so I have to still go a couple weeks a year to do my military reserve time. And then when I got out, I got stationed at Wright-Patterson Air Force Base. And that's where I did my residency training in OBGYN, was at Wright State University and Wright-Patterson Air Force Base. And then the military moved me to Omaha, and I practiced medicine in the military in Omaha, where we worked really closely with family medicine residents at University of Nebraska. So by accident, I started teaching right away. It was not necessarily my plan to do academics. My plan was to just practice medicine and be an OBGYN, but it was kind of part of the deal in the military that we had family medicine residents, military residents, and we were responsible for teaching them the obstetrics and gynecology portion of their training. So I started teaching right away. And then my husband really liked his job in Omaha. He practices hospice and palliative medicine. And we kept getting farther and farther from family. The next place the Air Force was going to send us was Elmendorf in Alaska. And even though we really loved the Air Force, he really liked his job here, and we decided that that Alaska was too far. So we ended our Air Force time and stayed in Omaha. And then again, I sort of started teaching by accident. I had my clinical job. I got hired with CHI, which is Catholic Health Initiatives. It's one of the health systems in town. And started sort of just showing up to things at Creighton because Let me go back. In residency, I helped to teach a class. Well, even before that, in medical school, I took a class called the Healer's Art, which is kind of about the stuff in medical school they don't teach you, not the science stuff, but the how to deal with grief and loss, and how to deal with like the mystery and the things you can't explain, and how to do the medical profession for your life as a lifelong career without getting burnt out, and like all these really cool topics. So I had taken that class in medical school, and then I had taught it at Wright State when I was in residency. I had helped lead the course. So when I got to Omaha, I had literally cold called the 2 medical universities that are in town and asked if they offered that course, and told them that I wanted to come and volunteer to help to lead it, because they're small groups and they need a lot of volunteers. So I just showed up. That's really what happened, is I just showed up and I started doing that course. And then slowly but surely over time, I started taking call with the residents. I started giving a couple lectures to the medical students, and like they kept asking me to do one thing more. And then finally they were like, you're putting in so many hours, why are you not on faculty? And so again, sort of by accident, I ended up doing this academic role. That was unplanned, which has been really cool. My clinical practice is still really busy, so it's a lot to balance, but it's been fun. Then I got put in charge of the 3rd year medical student rotation. So when you're in medical school, your first 2 years, at most places, everybody does it a little different, but the first 2 years are usually like in class, studying, and learning the basic sciences that you need, the pathophysiology, all that. And then anatomy, everything. And then your second 2 years are your clinical rotations. And you rotate through, you guys probably know a lot of this, but you rotate through family medicine and psychiatry and general surgery and internal medicine and pediatrics. So a lot of them general, most, the biggest specialties. Obstetrics and gynecology is one of them. So I was leading the 3rd year rotation in OBGYN. So I was in charge of the med student grades and the rotation and the med student experience and lectures and everything that came with that 6-week block that the students came through on OB. And then I am not doing that anymore. Somebody else just took that over, and now I'm in charge of the 4th year students. So the ones that have chosen to go into OBGYN, it's a smaller group now. But I do, I help them with the application process and interviewing and a lot of their 4th year experiences. So there's about a million other things that I do, but I don't want to bore you guys to death. I want you guys to get to ask your questions, because another thing we have, just so you kind of know, there's so many things you can do with medicine, but we have a family medicine obstetric fellowship, which means somebody went to family medicine residency and wants to take care of babies and old people and the whole spectrum of life, but also wants to do obstetrics. And so we have a program where we take them for 1 year after their residency is finished and do a 1 year specialty training just in the OB part. And so I'm also in charge of that.
What benefits are there of going through the military to do medicine?
So the main benefit that most people love is that it's a scholarship. So they paid for medical school. Medical school is really expensive, but it is not worth it to go into it just for the scholarship. So if you don't have buy-in, I guess is what I'm trying to say, for the mission, like the military mission, the military lifestyle, it's not worth it, because it's a lot to put up with and go through just for a scholarship. There's other ways to do scholarship. You can do the National Health Service Corps. You can work in an undersaved area and get tuition repayment. Like there's a lot of ways to get assistance with finances for med school. So the military is not the only way. It's an awesome way. Obviously I'm biased. My dad was military. I've come from a military family. But if you don't support them, like the mission of the military and the ideas and the fact that here's a negative, the fact that they like sort of own you and can tell you to move wherever they want. If you're not for that, then it's not worth any amount of money. So I had a couple people sit me down when I was doing this and say, are you sure? Because they're going to tell you what you can do and what you can't do, like as far as even specialty. So sometimes, like, there's only, say, 10 spots for OBGYN. And if you aren't one of the 10 people they pick, then you have to do something else with your life. Like, not forever, but for a few years, maybe be a flight surgery or general medicine physician, general medical officer, they call it. So you might be delayed in your career a little bit, or might have to choose a different path, like doing family medicine and then OB or something like that. So I was lucky to get a spot in the specialty that I wanted. They also will tell you where to move. So I was supposed to go to Andrews Air Force Base in Maryland. And like literally 3 weeks before I was supposed to move, like I had an apartment and everything. They withdrew they didn't give me my orders, and they said, actually, we need you somewhere else. And they said, you're going to Omaha, Nebraska. And I said, where am I going? And I pulled the map out and I was like, ooh, that's in the middle, literally in the middle of the country. And I thought at the time in the middle of nowhere, but it's not true. It's like a big city, but it was really funny. So you have to be very ready for that stuff. And it's awesome. And I totally am not trying to talk you out of it. I'm just being honest about it. Like, it's a scholarship and it's amazing, but also there's a lot that goes with it.
Tell us a little bit how, if you remember back that far, how Carol prepared you.
Oh yeah. I do remember. I remember my teachers and my classes. I do remember. It's just great. I don't know, like, I think there was opportunities for all different kind of classes, like, advanced placement or honors, which those helped me prepare really well for undergrad, and then undergrad helped prepare me really well for med school. So it's sort of just, I got started on the right path. I had really good support. I had people I could go back and talk to or ask questions to if I needed to. And it wasn't just the academics. It's like everywhere I've gone, I've been lucky. I've been doing this little tour of like Jesuit universities and Marianist universities. So I've been like in Catholic schools my whole entire like time. Like I went to, Dayton after Carroll, and then I went to Loyola, and then now I'm at Creighton, and they're all Catholic universities that have this underlying ideology of like treating the whole human mind, body, and spirit, sort of like, it's called cura personalis. And it's, I think that started at Carroll, that idea that like to be in service to others, it's not just like prescribing them medicine and trying to fix their problem. That's not what you're doing. So I think that all started really early, and definitely was started at Carroll.
Awesome.
I'm thinking about going into nursing, but like if I wanted to become a doctor, say I went through nursing and I wanted to become a doctor, is it hard? Is that transfer over like sort of hard, or would it be about as normal as like just going straight to like a doctor?
Yeah, that's a really good question. I think also ask a nurse that question too, just to get a different opinion. But I think it would be a hard transition and just like a really long time of school to like go back and start over. It's definitely possible. It's not impossible. I've met people who've done that. But now there's so many opportunities for nurses to be advanced practice nurses or nurse midwives or nurse anesthetist. So there's all these advanced degrees you can do in nursing. So if you go to nursing school and then you want to do more where you're in a physician role, or they call it a, what's the word they use? Like, not physician assistant, because that's actually a different kind of degree, but there's like all these roles where nurses are being independent providers for patients without going to medical school. So you can, like I said, you can be, that's called advanced practice nursing. And it's basically getting like a master's degree or a doctorate degree in nursing. And you can practice in a family medicine office right next to the physician and be another one of their partners in the practice with their, but then you have them to go to for guidance or assistance. But it's like you still have your own patients that you're caring for. You can prescribe things. So I think if I went to nursing school and did all that work, instead of starting over and going to medical school, I might choose that sort of path where I do more of an advanced nursing degree. Midwifery is another advanced nursing degree I can think of. And then, like I said, nurse anesthetist. So going into anesthesia, you can actually do that from nursing.
What advice would you give a student trying to get into medical school?
Into medical school?
Yeah.
Just study hard and work hard, but also be well-rounded. Like anymore, honestly, I joke with the students and the resident applicants now that honestly, I don't know if I'd get in, anymore, because they have to have so many things on their resume. So it's not just good grades anymore, although that is part of it, but it's also showing that you have good volunteerism and that you've taken on some leadership roles and that you've maybe involved yourself in some research. And also that you have some life experience, with not necessarily a job or anything, but just some defining sort of experience or maturity. It's just so different than it was when I went through. The candidates are so well-rounded and have all these experiences. And so, and I think, again, that's another thing Carol sets you up for success for, because you guys do that at school. Like I know they have volunteer opportunities and they have a lot of different clubs and roles you can take on at school. So like you're already doing that. You're probably prepared to do that also in undergraduate school, and then it just like once you have that as part of like what you do at school, what, how you are as a person and in your career, then you'll keep doing that sort of thing, even in medical school and beyond. So I think that's another way Carol sets you up, just because they offer so many of those opportunities. But I think you have to be well-rounded in those ways. Leadership, volunteerism, research, and then academics. So that would be my advice. My other advice, I don't want to get in trouble. When I was a senior, I did not want to take statistics. Honor statistics. It was like the first year they offered it. And I was like, I don't want to do that. And my dad was mad at me because he said that my GPA was going to be lower because I didn't take honor statistics. Instead, I took theater arts, which was way more fun because I was a senior and I wanted to take theater arts. And it was great. And my dad was mad. And guess what? I'm still a doctor and my life is fine. So even though I said all those things about doing all these things and having great academics, it's also like, okay, like you're going to be okay. There's people in medical school that had their undergraduate degree in literature and in theater and in business and in communications and stuff totally unrelated to medicine. And those people are also so well-rounded and come from like even a different like perspective, which is really cool in med schools like that. So don't feel like cornered, I guess, into a certain path. I shouldn't talk bad about honor statistics. Sorry,
I don't know. So along those lines, so obviously you can major in many different things in order to become a doctor eventually. Do you have a recommendation as far as a certain path that they should focus on?
Well, I think you need your basic sciences. Otherwise, when you go to apply for medical school, you're going to have to take more classes. So even if that's not your major, there's like certain requirements you have to have for med school. So if that's the path you want to go on, you just have to make sure you get the requirements that are like standard, at least. So it might end up doing like more course load because your major is political science and you have to get all those courses, but you have to also get your basic science stuff that you need for medical school application.
That makes sense.
Yeah.
I mean, you do all these things and have such a wonderful life, it sounds like. So how do you manage like the work-life balance while doing all these things?
Yeah. I have a really nice husband. He's a way better person than me. He's like so nice. So I am working on that still. it's definitely hard, and it can definitely teeter-totter like this, you know, one way and the other, depending on where you are in your career. So that's why I stopped being the third-year student clerkship director, to be honest. It was too much. I reached age 43 and finally found my limit. I had officially bit off more than I could chew, which is pretty good, I think, getting to 43 years old and not yet biting off more than you could chew. But I got there, and I wasn't loving that balance. I wasn't having that balance. And so I gave up that position purposefully. So I think you just have to keep checking yourself. And when I gave up that position, things immediately got a little better, back to the way they were. So I think you just have to keep checking yourself. Obviously, I have a very supportive partner who has a little bit more of a flexible work schedule. And so I can call and say, I'm in a delivery, or this patient's about to deliver, go get the kids. And we've had a lot of support. So we're out here without any family, which is a bad life choice. So if you are going to be an OBGYN that also does academics and is married with children, probably live near your mom. That's a good piece of advice I could give you. I'm sort of joking, but not. So I'm really far away from everyone, which just made it harder. And so I have just had to like find people that I trust and hire nannies and, you know, make it work. You just make it work, and then you just check yourself. And I did not like where I was headed with the stress and the busyness. And so I just cut back. So it's hard. So, but I think more and more, there's different ways you can do it. Even OBGYN, there's different ways you can do it. Like, and there's a million medical specialties out there, and they're probably not all as crazy as OB. Like, if you talk to somebody in a different specialty, the way they balance their life is probably a little bit less insane than mine. Because OB is just a little bit unpredictable. Like, I go in at night, I go in on the weekends, I get caught late at work. There's just emergencies that come up and things that come up in a more unplanned way. But there's a lot of areas of medicine where it's not that way. You go to clinic at 8 and you come home from clinic at 5 or 4, and it's scheduled. So don't walk away from this thinking it has to be quite so hectic. It can be what you want. You can make it what you want. And I think I was going somewhere with that. That even in OB, there's ways to make it less hectic. Like, they have even now like a shift work, almost ER type of like role for OB, where you can just do shifts on labor and delivery. So like they have some people just practice gynecology, which is a little bit more scheduled. I definitely practice a more old-fashioned model of OBGYN, where you do it all and you go in for your own deliveries, and you a lot of practices, like there's 20 partners in the practice, or 12 or whatever, and you're on call only a couple of times a month, and you only go in for the deliveries when you're on call. You know, so there's, just because I'm doing it this way, that doesn't make any sense, doesn't mean you have to. So there's better ways to balance it. It doesn't make any sense anymore. It used to. So everyone's sort of transitioning to a better way, probably, of doing things for work-life balance.
What's the best thing about being an OBGYN?
Oh, that's hard. I love what I do. I mean, probably delivering babies. I mean, that's like never gonna get old. So it's awesome. But also like just taking care of women, like their whole lifespan. So, you know, I take care of some teenagers, and then, you know, I might deliver their babies, and then I might do their hysterectomy if they have a, you know, problem and need that. And then I might treat them for their menopause. You know, so I like that sort of continuity of taking care of my patients for a long time. But I think hands down delivering babies, which is why I don't understand how people get rid of the OB part and just practice gynecology. But everybody likes different stuff. Some people like the surgery part a lot, which I also like. But
how did you handle the path to become
the doctor? It's a really long path, lots of schooling. Did you feel like your life was on hold, or I can't remember when you got married and all of that. Like, were you able to continue life in the process of becoming a doctor, or did you find that you needed to do the schooling first and then do whatever?
Yes, I did hold my life, not on purpose.
Yeah.
Necessarily, I think as a side effect, like I didn't say I'm never getting married until I'm finished with this or having kids, but that's just what happened. Probably because I was so busy, but a lot of people got married and had babies during medical school, during residency. I don't think I could have done it. Working
Yeah.
8 hours a week. I mean, in residency, there's a work limit of 80 hours. That's the limit. It used to be worse. They had to put a limit on it because people were getting abused. So, an 80-hour work week as the standard is it was not conducive in my mind to any of the rest of that stuff. But I have colleagues that did it, and they did it well, and they rocked it. So I think that's very personality dependent and who you are and what kind of support you have. But for me, it wasn't for me. I don't know how people did it. I mean, people do it, but I don't know how. I definitely waited. Again, not on purpose, like as a conscious choice, but that's just when it all fell into place. But I didn't have babies until I was an older lady. So I was in my 30s. My second baby was when I was 36, and they put advanced maternal age all over my chart. And it makes you feel bad about yourself, but still it's fine. It's still fine. So everybody's different. I think that's more based on who you are as a person and what kind of support you have. I think everybody's like way is different, but for me, for sure, I waited.
Or in college, you were talking about doing research. There are specific types of research they should focus on.
Did you hear that? Okay.
I don't think so, because I don't think anyone like say you want to go into internal medicine. You know what I mean? I don't expect anyone interviewing you for internal medicine residency expected you to know what kind of medicine you wanted to do when you were 19, you know? So whatever you do, it's experience. So if you do some cool research in college that's in chemistry or, you know, something that's totally unrelated to what you're going to do in the future, I think it doesn't matter. It's just that experience of having done research and knowing about research. Now, in your 4th year of medical school, if you know you're trying to get into residency internal medicine, that's a little different. Then you might, at that time, if you know, I want to do cardiology, that might be the time to choose research in the 3rd or 4th year of med school that specifically helps you get into the program that you want. Does that make sense?
Yeah.
So the early stuff, I think, is just the idea of the experience.
So you're in Omaha.
Yeah.
If you attended college in a different state, does it transfer? Am I saying that right? Okay.
Yeah. So I think, like, as long as you graduate with a degree, then you can go to the next step. So, like, you know, my undergrad degree was from Dayton, and then I had that, and then I applied, you know, I did the exams I needed to do for med school, the MCAT, and then that all is like national. And so then I applied to med school, and I ended up going in Chicago in Illinois. And then that degree, that medical degree, I could take that degree and I could apply to residency anywhere. Now the medical license is a little different. The license you need to practice in that state is state by state. And so when I was in Ohio, so after I graduated school and then I was in Ohio, I had to get an Ohio medical license, which I still have, because once you have it, it's just easier to keep it forever. And then I moved out here and I had to get a Nebraska medical license. But that was like after all the schooling was finished, and it just like where you're going to practice. And then I also practice in Iowa, because Omaha is right on the border of Nebraska and Iowa. So I also have to have an Iowa medical license. So that's kind of annoying, because in the military, you can get moved all over and have to get a lot of different medical license. But most people hold a few. Most people don't hold one just in one state. So that's the time when it becomes like state by state kind of thing. The degrees and the like certification exams, those are all transferable. And
How difficult is it to get a medical license?
it's a state. It's really weird. Like in Iowa, a huge pain. But in Ohio, not a pain.
Hmm.
I don't know why.
And how long do they typically last?
You just have to recertify every year or two. You have to pay them. I mean, you have to do a certain amount of what's called continuing education. So that'll be in anything, veterinary school, dental school, nursing school, medical school, like any of them. There's like a continuing education component. So you'll have to, like, after you have your degree and you graduate from school and you're working every year, you have to just do a certain number of hours of either reading or attend a conference or, you know, keep learning and staying up to date in your field. So that's a requirement of the license, and then paying them money basically is the only other requirement.
Interesting.
Yeah.
So what's the difference between working medicine in like a rural, suburban, or like city area?
That's a really good question. I think that rural medicine, which I didn't really have an experience with until I got out here to Nebraska, is like the family medicine doctors that practice rural that I know, they tend to do a more large, like full scope of practice. Like what they do in their practice is a lot more than the family medicine doctors in the city. So for example, the family medicine doctor in the city will like see the patient in the clinic for their routine problems and then make referrals like to the specialist, or like for their colonoscopy or for their pregnancy to a specialist. Whereas like the rural family medicine doctors deliver their own babies, and probably a lot of them do colonoscopies, and they have less people to refer to, or if they refer their patients, they know their patients have to drive really far to get there. So they tend to practice a little bit different style. And then I think for the patients, there's a little bit, I mean, they have those basic doctors in their town, but then, for example, I go out to one of the rural hospitals once a month. So then if they want to see the gynecologist without driving an hour, then that's their day. They don't get you know, there's no other day. So it's like they don't have as much flexibility. It's harder to get an appointment. And then you know, some of my partners go to different rural hospitals. So sometimes the specialists come in from the city and go out there, but it's limited. For like my specialty practicing OB, they do have some OBs out in rural Nebraska, in different parts, but not in really rural Nebraska, just in the bigger towns. So still you have patients that are really rural, driving really far, which makes it hard if there's an emergency. You just have less support, less blood products, longer transfer in an emergency to get to, you know, a hospital where they can respond to that specific emergency or problem. So I think it's a very different style of practicing medicine if you're rural, and some people love it, and it's definitely for them. And some people not so much. So it's really cool to experience. A lot of residency programs now have a rural track or rural experience or rural rotation. So you can go out and actually, and med schools too, some med schools have that kind of experience. So you can actually go get that experience and see if you'd like it. And then there's even kind of two styles of hospital, even within more city areas. And maybe that's kind of what you meant by like suburban versus city, is like there's a more community hospital feel where I don't even know what a good example is in Dayton anymore. I used to say Kettering Medical Center, but now they have a lot of like teaching and residents and academics at Kettering. So I don't know. But it used to be the difference between like Kettering and Miami Valley. But now I think that's changed. So that's old. But Miami Valley was the huge, big central hospital that did all like the tertiary care and the trauma, and you know, and it was the big center. And Kettering was a little bit more like small community hospital. And I practice at both in Omaha because my clinical practice is in a community hospital, smaller, but my academic stuff I do with the students and residents is in the big center. I like the community hospital better. Don't tell anyone. It's just like, you know, all the physicians, and you it's more like collegial and intimate's not the right word, but like small, and the labor and delivery is smaller and less busy, and there's not 100 people in the delivery room because there's 3 nursing students and 2 medical students and a resident, so I guess, I mean, that's good too, because people have to learn, but I also like the speed and the feel of the smaller hospital too. But again, I sometimes have to transfer patients to the big busy place. So, because that's where like the neonatal intensive care unit is and things like that, the specialty stuff. So there's pros and cons of all kinds. That was a really long answer to your question. I'm sorry.
I was gonna ask how like well prepared you felt after your undergrad to like passing the MCAT, or like how much extra work we should expect when like studying for that. Do you have any tips or anything?
Okay, so you said, how well prepared were you after undergrad?
Yeah, like for the MCAT and like what?
For the MCAT, and then,
How you prepare for the MCAT.
oh, how
Yeah.
you prepare for the MCAT. Your hair is awesome, by the way. Can I say that?
Thank you.
Fantastic. You prepare for the MCAT by not going out to the bars when you turn 21 with all your other friends who are juniors in college. That's how you prepare for the MCAT. I'm sort of kidding, but not really. It's like everyone else had fun, and there was a solid 6 months of undergrad where I studied. Me and my one roommate, who were also taking the MCAT, studied way more than anyone else. And you just have to be okay with that. You have to dedicate yourself to it. It's hard. I think taking a preparatory class is good, but I did that for everything. I did that for SAT. I did that so maybe for me that just works. Everybody's different, but I did an MCAT prep course. I even did boards prep course when it was time to do like my medical boards, both in my specialty and just the general boards you have to take in medical school. I did a prep course for all of them. And so that was like one night a week when I had to go to that prep course for MCAT. I think they held it at Wright State. I think it was at Wright State at that time, but so that night I knew I wasn't going to get any of my regular coursework done or write my papers or study for like my exam that was on Friday. So I had to really plan for that because, that night was out because it was for MCAT prep. So for me, the course was a good way to like take time aside specifically just for that studying, because I do think you need to do some separate studying. So, I mean, it's hard work. So,
And did you feel like your undergrad did prepare you?
Sorry, I couldn't hear you.
Did you feel like your undergrad prepared you well?
Yes, I mean, in general concepts for the MCAT, those like entrance exams for grad school are so different, and there's such a specific knowledge set that you need just for the exams that I think you can be generally prepared, but not, I think you still have to do studying. Like, even if you don't do a prep course, like I had also these flashcards for the MCAT. And I remember being home on break from college and like doing flashcards with my mom. Like I think it's probably the same for the LSAT, the law one, and what is there, a GMAT? I'm trying to remember all the letters, but there's different ones depending what you're going into. And I think all of them require like just a separate studying time or study books or prep course than just general undergrad prep. I don't think if you just walked out of your undergrad classes into the MCAT, I don't think it would go as well. It wouldn't have for me, at least. It's too specialized what they want you to know for that.
Anything else? Any other questions? This is great, by the way. Thank you.
You're welcome.
Well, thank you so much for being with us today. I know you're a very busy woman, so you probably have other things to be doing. So
no, it's so fun. I love it. Thank you guys for the great questions. If you guys have follow-up questions, Mrs. White's has my email, and I'm happy for you guys to email me if you need to, and just let me know. You guys are going to do great.
Thank you so much. Thank you. It was great seeing you.
Bye, you too.
Bye.